Ideally, you should be seeing patients here seeking medical services. They are not there simply because they could not access any services there. So it's really a health crisis at public health facilities right here in Nairobi, as hundreds of patients remain stranded with no services rendered in the 19 county hospitals. So a spot check at the 2 referral hospitals, Kenyatta and Mama Lucy, shows that only emergency essential services was being offered, as admissions, critical diagnostic services and operations are suspended for lack of medics. 245 medical doctors serving in the facilities under Nairobi Metropolitan Services are on strike to protest delays in implementation of a comprehensive medical cover, as Dorcas Wangira reports.
At Mbagathi County Hospital, empty beds with just a handful of patients within the wards, but unattended. There are no doctors doing rounds in the wards. The situation is similar in the labor ward, with more unoccupied beds than patients. More unoccupied infant incubators than infants. We are able to identify one nurse on duty. What happens when there is no doctor? In a hospital such as this one, where on average 20 normal deliveries a day are carried out, less than 10 can be carried out. Likewise, on average 10 emergency cesarean sections can be conducted in a day. Only 2 were carried out in the last 24 hours. The hospital operating at 20% capacity, with only clinical officers who cannot conduct complicated diagnostic services at hand.
If you go to Mbagathi, you'll not be treated. Where else will you go? They want to refer you to Kenyatta Hospital. Kenyatta Hospital is not working. So where do this government want our patients to go? Doctors are going on strike, not because of a pay rise, not because of a promotion, but because of a comprehensive medical cover. Medical cover, something basic, something very simple.
At the Mama Lucy Kibaki Hospital, there seems to be teeming activity, but most of the services being offered are routine, including immunization and antenatal services. But there is no ongoing admission. We find patients waiting outside, feeling the impact of the current day 5 of the 255 doctors' strike in Nairobi.
In the morning, we were told that walikuwa strike na hawahudumii watoto, but after kutoka tukafika kwa gate tukaambiwa they are carrying out the activity as usual.
Only emergency services are being provided by doctors on contract. Nurses and clinical officers are holding fort. According to the Doctors Union KMPDU Nairobi branch, 4 consultants in this particular hospital have not been paid their dues for the past 27 months. The doctor's strike has been occasioned by a lack of comprehensive medical cover as provided by NHIF, non-payment of September salaries, and non-payment of salaries of consultants.
Nairobi County did their bit. Unfortunately, NMS has been unable to do anything. None of the things that we signed on the return to work formula has been done. We want an AAR cover. It doesn't work for doctors. You know, a doctor cannot give services and then you expect them not to be able to get the same services. It is so unfair.
At the Kenyatta National Referral Hospital, the situation is the same, with doctors on strike. In this situation, CS procedures are being carried out by medical officers and supervisors as the strike persists. More than 300 lecturers who also offer medical services at the hospital downed their tools over the withdrawal of clinical allowances. The union says it is open to negotiations to avert a more severe situation. Dorcas Wangira, Citizen TV, Nairobi.